from Universal Studios Hollywood. Welcome to Home and Family. There is a new way, by the way, changing gears to greatly reduce and improve the appearance of scars. Here with some wonderful information to share with you. Welcome, Doctors Payman Danielpour and Layke. Yeah. Welcome, gentlemen. Thank you. I will say, I have been told by many ladies that men with facial scars is very handsome.
Yes.
True.
Yeah. Oh, he's going to go home and cut his face now.
Oh. But you guys are here to say, you know what, we can take this, we can take these scars away.
Well, we're here to discuss a revolutionary new scar dressing. Ultimately, will reduce the appearance of scars. And so for those scars that are either painful or thick, some from tummy tucks, from traumatic surgery, things or traumatic indications, that this particular dressing will reduce the appearance.
Is there
we'll talk about the
a statute of limitations to scars? Yeah. I mean, can they be, how old can they be? Well, what I'm getting at, I have a cesarean scar, so could you do that?
That's exactly what I was going to bring up. She's about to have a baby, so
well, I had mine
if it's a C-section. If it's an old C-section, obviously we'll have to revise it.
Oh, okay.
Old scars we really can't do anything about.
Oh, well.
For the newer ones, we can always address it by revising it and then placing this dressing.
So what happens when you revise that? Does she have to go back and give birth again and go through that whole process?
Me?
Yeah.
Oh, no.
Like,
no.
No.
It's all up to her.
Can't.
Be mom again. It's all up to her. We are shifting gears seriously. We're going to sit down with Doctors Payman Danielpour and Layke to talk about scars.
Do you have a scar that's been bothering you, whether traumatic or post-C-section? We have a new revolutionary dressing that can help you and that ugly scar that's been bothering you.
All right, we're back. There is a new way to dramatically, and I mean dramatically, reduce scars from surgeries like C-sections or tummy tucks, and you can do it without pain. Now you got my attention. Not that I've had either one of those, but I'm sure I have some scars. Here with more plastic and reconstructive surgeons, Doctors Payman Danielpour and Layke. Welcome, gentlemen.
Welcome.
Good to have you. Can we talk a little bit about, just take us through what the body is doing when scarring happens? We have a cut, we have a surgery, or we have surgery or something.
Sure.
Professor?
Scars are, the scar formation is multifactorial, and you have to imagine that the body sacrifices form for function, meaning an open wound, the body wants to rapidly heal, fill it in with collagen as fast as it can. Now, with that being said, the downside is it doesn't look that great. And so the other factors that go into play are genetic. Some people have more pigmentation, the thickness, the severity of scarring. There are definitely different factors that happen. So,
or a keloid, is that a factor that I should be considering?
A keloid is the next level. It's a thickened scar, but on steroids. It's a separate type of signal where the body just loses track of where it's healing, and it continues to build up more collagen.
These are just the cards we have to play. There's no way to prevent scarring.
There are, and that's why we've come up with new dressings like the Embrace dressing. Stanford researchers basically came up to how can we prevent scars from forming, or at least make them as minimized or as inconspicuous as possible.
But regardless, we're gonna have scarring. There's no way to say, hey, we have surgery and it's never gonna scar.
Unless we're a fetus. That's the only way we've shown that the fetus can heal scarlessly. Other than that, no.
That's it. Okay, so now we're left in chasing this thing and trying to make it appear as if it wasn't there, or at least dramatically reduce it. The common ways we used to, before we get into this, to treat scars?
Traditionally we've used a number of different things, such as steroid injections, lasers, and there are currently some dressings that attempt to play a role. But there's never been any data to show that these actually work, as far as scar creams, gels, silicone sheets, and cortisone shots. Comes with its own set of problems, and so that can improve the appearance of a scar. But really, we're trying to deliver something that will give you all the advantages without the disadvantages.
So, what's the new way? What are we talking?
So this new dressing, what we have is a mechanical way to kind of prevent scarring.
What it does mechanical?
Is everything we've done before has been either through creams or through lasers or through injections. We're trying to change the physiology. This is mechanical. So the way scars form is through what we as plastic surgeons do is we try to take tension off a scar. So this new dressing is basically a pre-stretched silicone sheet that when you put it on a wound, it takes tension off the wound in order to get a nice straight line fine scar. And that's what we're looking to do. So it's basically offloading tension through address it.
Demonstrate how this works.
We have an animation, so we can see exactly how it works. So let's take a look at that.
Take us through this, will you, Doctor?
Here you're actually seeing this is the biocompatible dressing, and as you load the dressing, you can see it stretches. And when you apply this to the actual wound itself, imagine this is a pre-stretched silicone sheet. Once you release the dressing, it will shrink and therefore offload all the tension on a wound.
Oh, and so that helps the healing process.
Definitely.
Going through.
Improves the appearance of it.
I can actually show you it real simply here as a demonstration, showing you what it looks like, and just put it on a piece of paper, how easily you see it. Takes tension off, and you'll see.
And this is a normal piece of paper. I know it's colored, but it's just a normal piece of paper.
This just gives you an idea of, the dressing itself has some protective coverings, which will release the sticky side. And now you can see as I'm loading the dressing, the actual dressing itself stretches. And so now, when I apply this to the scar, and it's pressure sensitive, so basically we smooth this out onto the area, and it's simple pull tabs. And this will demonstrate what happens. It immediately shrinks. And so by offloading the tension onto a wound, this really greatly reduces the appearance of the scar.
How long do I have to keep that on there?
So basically, each dressing you apply between 7 and 10 days. So once this goes on, you go about your business. You can exercise. Normally, first 6 weeks after surgery, we kind of hold people back from doing any strenuous activity. But you can shower, you can go swimming, you can do pretty much everything with this on.
Well, so, can I just talk from a woman's point of view? I've had a cesarean, so I know how it hurts. You put that on right after surgery, and it does, because wow,
you do it a week after, and everyone basically gives us the feedback that it feels good. They feel safer. It's protective for them. And then they wear it for 8 weeks. That's the course of treatment.
So let's say we have some before and after pictures, and as we take a look at these before and after, I want to ask you how critical it is to get this implemented right away. You said wait about a week or so, but then is there a small window of time? That's remarkable.
Usually we wait a week after just to make sure that the wound itself is dry, clean and dry. And so this gives you an example. I usually call this BE, before embrace. And these are wounds that are under a high amount of tension. You can see that ropey type of scar. Even the difference in pigmentation, everyone is a little different, but you can see, you can choose yourself or determine if you see a difference. This is a chest scar from someone who had a cardiac surgery, open heart surgery, and you can easily see the difference in results.
So these are the kind of procedure, the type of scars. You're talking about C-sections, tummy tucks, chest.
We actually use them on the face now. We have a small dressing like this, because people hate scars on their face more than anywhere else, obviously, because you can't cover them up. And we take care of a lot of children right here in LA and Beverly Hills, where they don't want scars on their face. So we put this on there to limit the size, the appearance, and color of wounds pretty much anywhere on your body. A mole removal on the face, things like that. It could be used for anything that's post-surgical.
Didn't look painful to me. For more information on our doctors today, Danielpour and Layke, you can go to BeverlyHillsPlasticSurgeryGroup.com. You'll find some more of your questions answered there, I'm sure. Thank you guys so much. This is really, it's like one of those things you go, why didn't I think of that?
Yeah.
I'm not smart enough, first of all. We're coming back, and Christina's in the